The next chapter is about the shonita. Shonita varnaniyam adhyayam vakhyasamaha iti yathovacha bhagavan dhanvantari. Shonita as such is translated as a blood, but there is something more than what we generally consider as a blood. In when we go to the description of the shonita in Ayurveda Samhitas. तत्र पाञ्चभौतिकस्य चतुर्विधस्य षड्रसस्य द्विविधवीर्यस्य अष्टविधवीर्यस्य वा अनेकगुणस्य उपयुक्तस्य आहारस्य सम्यक् परिणतस्य यस्तेजोभूतस्सारः परमसूक्ष्मः सः रस उच्यते तस्य हृदयं स्थानं स हृदयात् चतुर्विंशतिधमनीः अनुप्रविश्य ऊर्ध्वगाः दश दश अधोगामिन्यः चतस्रश्च तिर्यगाः कृत्स्नं शरीरम् आहारः तर्पयति वर्धयति धारयति यापयति च अधस्सहितकेन कर्मणा. Now, all that nourishment which is taken by the body from the food, the different sorts of the food, and the potencies of different varieties of the food, only those which are substances which are required for the body, they are selectively absorbed by the body. So that's the important function. And how this is done, like how the body knows like what is required and what is not required. Sushil says it's adhasta hetukena karmana. There is some functioning which is not visible, which is not seen to the naked eye. Now we have a theory of a selective absorption. Selective absorption in the sense that only when the body requires the substance it is taken in case of the Ayurvedic Samhitas also, the same is mentioned as the Khare Kapota Nyaya, where there would be a receptor, and only when the receptor is activated, that specific substance is required. So there is a very complex cycle of maintaining this nourishment, and we will have more details about these complex cycles later on when we go into further details of the dosha dhatu and so on. Now, all that substance which is taken in selectively, which is required for the body, that's called as rasa. The important is a rasa of one person and the rasa of another person may not be equal because the requirement of the body may change. So, to standardize the quality of the nourishing fluid, so I would not say whether it is the blood or so on, it may not be the same because the quality or requirement of these nourishing substances could vary. Or even in a single person, the quality may vary from time to time. Like in the initial stages, younger age, the quality would be different. The later ages, the quality would be different because the requirement of the nourishment in these stages would be different. Now, those complex issues, more details of that, we will have opportunities to deal with in due course of time. But important is that you cannot standardize the substances which are required for the quality as a fixed standard. Now, once it is taken in, then Sushil says it's a Hridayam Sthanam. It's a, in the Hridaya is the controlling area where this nourishment is spread over to the body. Now, there is again bit of controversy about the word dhamani. In this context, when the rasa function is mentioned, Sushil has said the dhamanis are having their controlling center in the Hridaya, and there are 24 dhamanis. And 24 among the 24 dhamanis, 12, 10 are directed upwards, 10 are directed downwards, and 4 are directed towards the surrounding area or horizontal area which distribute around the body. Now, there is a bit of controversy about the dhamani in Sharirasthana. I will come to that part immediately. In the next part, I will come to that part issue. Now, this nourishment, the rasa, that's the nourishing component of the blood, would be spread around the body, and it helps in tarpayati, it helps in maintenance of the nourishment of the tissue. Vardhayati, it helps in the growth of the tissue. Dharayati, it supports the daily functions of the cells. Yapayati, it is a one which maintains the life functions, essential life functions of the peripheral tissues. Life functions in the sense primarily the metabolism. That's metabolism again has two components: catabolism and anabolism, and then excretion of the substances, and the fourth is regeneration. So these are the yapana. The yapana functions are the maintenance of the nourishment in form of metabolism and help excretion, and then of course the regeneration. तत्र शरीरम् अनुसरतो अनुमानात् गतिः उपलक्षयितव्या क्षयवृद्धिवैकृतेः. Now, the flow of these and the functions of these rasa has to be assessed by Anumana Pramana, because it cannot be assessed by the direct Pratyaksha Pramana as such. And it has to be assessed based upon the signs of either an increase in the function or reduction in the function. So, assessing the functions, and by that you will have to decide. Now, when we say this, there is another important issue, rasa and the rakta. There are two words which are used. The rasa suggests about the component of the blood which is responsible for maintenance of the circulatory pressure and helps in the hydrostatic movement of the fluid. So, for the movement of the fluid in the body, you require that pumping action of the heart, and that pumping action of the heart is one which regulates the movement of the fluid across the body. Then there is another component of the blood which provides the oxygen, which is the metabolic energy required. That is the other part. Now, these functions, when we now say blood, the blood is integrated. Now, you do not make out that difference of that hydrostatic function and oxygenation function in the routine physiology. But when it comes to the question of disease conditions, this difference is made out. You may have a patient where there could be a volume lost, and you may have to replace the volume. And when you replace the volume, you will be either giving a clear fluid or only the plasma. Whereas there could be a patient where the oxygen carrying capacity is reduced, where the hemoglobin is lesser, where you give the concentrated or the separated cells as such, or packed cells, so that the oxygenation capacity is increased. So that function of the oxygenation and the function of the circulatory pressure or maintenance of volume, these are now in the current physiology. We consider them separately only when it comes to the question of the management of a patient with a loss of fluid as such, or the shock conditions. Whereas from Ayurvedic point of view, this separation is maintained in the beginning itself. So rasa is about that hydrostatic component where the function of the circulatory system which maintains that circulation or the volume capabilities, and the rakta is the oxygen carrying capacity. Now, of course there is a question by the student like Tasmin Sarva Sharira Avaiva Dosha Dhatuma Rashayanusarani Rase Jignasa Kimayam Soumyaha Tejasa iti, whether it is really nourishing or whether it helps in maintenance of the oxygenation or energy. That's the issue. Now, this kind of a difference is required because from Ayurvedic point of view, that nourishment is a Saumya function, and breakdown of that nourishment by the oxygenation or oxidation and then production of the energy is a Tejasa function where heat is released. So naturally you will have a confusion whether it is a Saumya or Teja. And Sushruta says, इत्र इह सकलु ध्रुवांसारी स्नेहन जीवन तर्पण धारणादि विशेषैः सौम्यः इत्यवगम्यते. That saumya component, that component which helps in the nourishment or carriage of the nourishment, is considered as the saumya or rasa. Now, there is another issue of controversy, confusion in Sushruta is, when you look at the Sharirasthana, there is a description of the Dhamani, and that the Dhamanis are mentioned as Tasam Tukalu Nafi Prabhavanam. Now, in Sutrasthana, Dhamanis are supposed to be having the Hridaya as the main controlling center, whereas in Sharirasthana, it's Nafi Prabhavanam Dhamaninam Urdhvagaha Dashavasha Adoghaminiha Chatasrastiryagaha. The description otherwise is same. There are 24 and 12 are directed upwards, 12 are directed downwards, and Chatasrastiryagaha. Now, the functions of these Dhammanis mentioned again are quite interesting. The Tatra the Shabda Gurtoga Hadasha Shabda Ras Rupa Rasa Gandhan Abhiganite Dwabhyam Bhashate Dwabhyam Ghosham Karoti, etc. Now, of course, I have not added these the Adhogathamani and Tiryagathamani, the important is about the Tiryagathamani. Tiryagatthamanis are those which would be having a network-like distribution around the body, and that helps in maintenance of the nourishment as well as the carriage of the substances which are absorbed from the skin. The beria is taken in. So that's the functions of the Tiryagathamani. That shloka I have not added. Of course, if you read this Sharirasthana, you will come across that. Now, the satisfactory answer for this kind of confusion would be, because I don't say that it's a confusion, it's about only the way you look at it. Now, when we consider the current contemporary physiology, we consider heart as the major source of the circulatory system. Now, the word circulatory system has come in because of William Harvey, who proved that the blood moves in a circular path and a blood from the artery enters into the vein, and because of that, the blood is moving in a circle, and that's why it's called as a circulatory system. Earlier to William Harvey, it was considered that the positive energy from the universe goes in the form of arterial blood and the negative energy goes out in the form of the venous blood. This was the earlier theory, but William Harvey proved it. This is what we usually believe. But really, the idea of a circulatory system, where a closed circuit, where the blood moves around in a circle, is originally of Ayurveda. Sushruta has described that very clearly. Now, when you draw a circle, suppose you draw a circle anywhere, and the circle, in that circle, the starting point and the end point, that has no meaning. When you say a circle, that starting point and ending point would not have a meaning, because for the sake of convenience, you may start at any point, and still you cannot just point out that that should be the starting point. Depending upon your convenience, you may say that one is the starting point and the other is the ending point. Now, when Sushruta says about the Nabhi and the Hridaya as the origin of the this circulation, or the rasa and the rakta, the idea is when there is a consideration of the pressure or the hydrostatic pressure, which is a force which helps in movement of the fluid, then heart is the major controlling center. But when it is a question of regulation of the nourishment, the flow of the blood and the cells gaining out of it, the functions, like they see when heart pumps, irrespective of that, heart pumps the blood with a single stroke, and the stroke pressure is always constant. But the blood which reaches to the tissue, it will be controlled by a neurological control. Whether the vessels at the periphery, glomus, if they will be opened or not, that depends upon the physiological requirement of the area. Simple. When you stand up, if suppose if there would be no neurological control, if you stand up, the blood should be flowing maximum to the leg, and the blood to the brain should be lesser. If you do a Shirshasana, all the blood will flow to the brain. This would occur if there would be no neurological control. But this, because of the neurological control, edenetic system, whenever there is a need to regulate the flow of the blood to a specific organ, that either the blood vessels are either constricted or they are dilated, so that the flow to the area is either increased or reduced depending upon the requirement. Like when you stand up, the blood vessels of the lower limb, they are somewhat constricted, so that the flow of the blood to the leg is reduced. Or when you have a sumptuous meal, after the meal, blood flow to the gastrointestinal tract would be increased, and at the same time the blood flow to the brain will be slightly reduced, so you will feel sleepy during that period. When you blush, the face becomes reddish because the blood flow to that area only is increased, so on and so forth. So you can give plenty of examples. So that kind of a regulation is done by the neurological system, and because of that neurological system is centered in the core part of the body, the cord. Sushruta has considered Nabhi as a center when it is about the function of the regulation. Moreover, Nabhi is also the area where the nourishment is taken in. Whatever the food you take in, the maximum amount of the nourishment is taken into the tissues through the gastrointestinal tract, and hence it is considered as the Nabhi Prabhava. So Nabhi Prabhava or Hridaya Prabhava, it's not about the origin, rather I would not translate this as origin, rather the regulatory centers. So when a circular system is there, the regulation is done at multiple centers depending upon the functions, depending multiple functions, and that's why you may consider these as the different controlling centers. So when you are suggesting about the hydrostatic pressure, you are bothered about the heart as the pumping center. If it is about the nourishment carried in and controlling the circulation in the periphery, it is the core part of the body, either the nervous system or maybe the gastrointestinal tract, which is a major area. Suppose if you are bothering about the oxygen control, it's about the lungs, which are the major controlling area, and so on, and so on and so forth, depending upon the different functions of the circulatory system. And hence, there should not be any confusion about, or we need not consider this as a controversy. Rather, we have to look at it with a different view as the different controlling centers of the system. But important is credit of main this establishing a circulatory system should go to Ayurvedic history. Both Charaka as well as Sushruta have accepted the same theory, and it's not for William Harvey who established it somewhere in 18th century. So that's one part. Then the other part is the maintenance of the nourishment of the peripheral tissue is done by the controlling of the nerves. Now, when you look at the functions of the adhoga and the is the urdhvaga dhamani, the functions of the urdhvaga and adhoga dhamanis are mainly the functions of the nervous system. The Tiriyaga Dhamani, it's again the functions of the nervous system as well as that's the Sukham, Sparsham, Sukham, Asukham Vajani, Tiriyaga Dhamani, that helps in maintaining this perception of the sensations, touch sensation, and at the same time, it also gives the capacity to absorb the nourishment from the surface of the body, whatever the lepa or the sneha dravya which is applied over the surface of the body, the virya is taken in and is regulated by the Triyagathamani. Now, this kind of a integrated function of the neurological control and the blood flow is the speciality of Ayurvedic perception of a system. In the present physiology, when we study these systems separately, circulatory system separately, nervous system separately, and this kind of a separated perception gives you the confusion like there is some error in Sushruta, but it's not that way. If you look at with an integrated function, and really the what as usually functioning is the integrated function is ultimately the one which you really see there. And if you look at that with the integrated view, there is no confusion as such, and it looks like that integrated perception is a better perception than the others. Now, the same Krishnam Shariram Maharaha Tarpayati Vardhayati Dharayati, the same issue, the regulation of the flow of the substances at the periphery, where the either oxygen is taken into the tissues and the waste materials they are taken into the circulation at the venous end, and the water and the glucose amino acids reach to the tissues. This is about the yapana, the so vardhana, dharana, yapana, the different functions as such. Now, once that rasa has been produced, there is one issue, and then the Sushruta also has identified the other component of the rasa, that's the rakta, the reddish color. The question about whether the rasa is saumya or taijasa, rasa basically is considered as saumya, but that saumya rasa, after reaching to the yakrit pliha, sa rasaha yakrit plihano prapya ragam upaiti, that reddish color added to the blood or the fluid, I have not used the word blood, it is considered as the rakta. Now, that red color is, as we know, it's due to the oxygen carrying substance, the hemoglobin, which is added to the circulation in the form of RBCs. Now, where the RBCs are produced, hemopoiesis, we know that it's now produced in the bone marrow, mainly in the bone marrow. But if you look at the hemopoiesis in the different ages, in before birth, the major area of the regulation or production of the hemopoiesis is the spleen and the liver. And once the the child has been born, then the bone marrow takes up the function of hemopiesis. So by the time the maturity occurs, intrauterine maturity occurs, almost all the hemopiesis would be by the bone marrow. Liver and spleen would stop that hemopietic function, and in the adult life, it's mainly the bone marrow, and there again the bone marrow. Certain of the bones will continue to produce these hemopiesis till the very late end of the life, late part of life, whereas some of the bones would be stopping that hemopathic function at a relatively younger age. So vertebra and the pelvis, the flat bones and the sternum, they carry on that hemopathic function till the very late stages of life, whereas the long bones, the hemopathic function will be stopped, somewhat reduced or sluggish as such. That's how the hemopiesis area centers would be changing. So when Sushruta says about the Ekriha, whether it is about the intrauterine life, the fetal life, or whether it is about the adult life. This is the confusion. Maybe it could be suggestive of the importance of the Ekrit and the Kriha in the intrauterine life. But in the contemporary situation, that's a very interesting issue. We give more importance to the bone marrow in the adult life for the hemopiesis, but it's well known that a patient with the cirrhosis, the red blood cell count can reflect the degree of liver damage. In a patient with cirrhosis, when the RBC count is lesser, that itself would be a sign of a patient worsening. The exact reason why it occurs is not known. There are many theories, the theories which may be attributing the liver function, and but none of the theory really establishes why the RBC count gets reduced. So there is something unknown still. The contemporary physiology doesn't know still about why the RBCs get reduced in a case of cirrhosis as the condition is worsening. Though we know that in a patient of cirrhosis, the RBC count tends to get reduced, and that reduction of the RBC count is a sign of a worsening of the liver condition, as this is practically used in the clinical practice, but we do not know why and how. So when Sushil says about Yakriha as the major source of the Ranjana or that hemopiesis, I think it has a clinical value. It has a clinical value, but the exact philosophy, exact reasons are not really understood with the contemporary system. So it's a inability of the contemporary system to make out than really criticizing what Sushra has said. Now, this addition of that reddish color itself would be adding that the Taijasa function to the Rakta, or it makes it the Rakta as such. Rakta word itself would have the meaning of a reddish color. Ranjita tejasatvapaha sharirasthena dehinam avyapanaha prasannena raktam ityabhiliyate. Now that Saumya rasa, when it is added with that hemopiesis or this oxygen carrying capacity, I would say instead oxygen carrying capacity, that is considered as rakta. So you may now say blood, but when we say blood, we do not make out this difference. Whereas from Ayurvedic point of view, this difference has to be made out very clearly, and that nourishing function and oxygenation function, they are considered to be the two different functions, Priyanam and Jivanam. Priyanana is the nourishing function, Jivana is the oxygenation function, and considering these two functions, they are considered as two dhatus. So whenever Ayurveda describes about a dosha of the dhatu, it's about the functions. Of course, this part we will be discussing more in the coming chapters when we discuss about the dosha and the dhatu. Now, another issue is the once this rakta has been produced, the same would be presented as a rajas in females. The menstrual blood is also produced. Now, according to Sushruta, that menstrual blood is something different from the nourishing blood of the body. Now, rasadeva striya raktam rajas sanyam pravartare tadvarshad dvadashad urdhvam yati panchashvatakshayam. By the age of 12, it starts, and by the age of 50, the menstrual blood flow starts, and this menstrual blood flow is a product of the same rasa and the rakta. Artavam shonitam agneyam agni shomiyatvat garbhasya. The artava rakta, the blood which is excreted out, is considered as where you will have only that the agneya part, the component which helps in the metabolism, but the nourishment part is lesser in the blood which is excreted out, because that part, the nourishing part, is utilized by the fetus. That's the hypothesis. Or there is a different version according to some Panchabhutikam Dvapare Jivarattam Ahu Acharyaha. According to certain schools of thought, the Rakta is considered to be Panchabhutika. To consider either it as a Saumya or Agneya may not be correct. Of course, that's the way you look at it. So every view is accepted. Now, the difference between the menstrual and the normal regular blood, of course, virtually, in the according to the present parameter, the differences are negligible. Virtually, there is no established biochemical difference between the blood which is excreted out during the menstruation and the normal, except for the fact that the coagulation is lesser and there is addition of debris of the mucosa, endometrial mucosa, and there is a slight physical difference, appearance as such, there is a slight physical difference, and this is exactly what you see as the difference as such. The blood would be different in terms of the content. The content in case of the menstrual blood would have the vaginal secretions and the endometrial tissues. Because of that addition of the secretions and the endometrial tissue, the appearance of the blood, the color, and the coagulability of the blood would be varying. Otherwise, as far as the physiological contents of the blood reaching to the placenta or reaching to the uterus is not really understood by the current physiology. Anyway, we will not go beyond that. Now, the qualities of the rakta or the shonita is Vistrata, Dramata, Raga, Spandanam, Lagutantada, Lagutada, Bhumyatinam, Gunashite, Shirte, Shonite. Now, because the theory is that it's a Panchabhutika, all the five Mahabhutas are there. Now, what is the Mahabhuta and so on, we will be discussing in due course of time. So, we will not waste time over this issue now. The qualities of the Mahabhuta are seen in the Shonita, and hence the Rakta can be considered as a Panchabhotika. So whether you perceive it as a Panchabhotika or mean Saumya or the Agneya doesn't make a huge difference in the outcome. And the reasons why it is considered as Panchabhotika is they have all the qualities of the Mahabhutas, which are the smell, which is suggestive of the Prithvi Mahabhuta, Dravata, the liquid portion, is suggestive of the Apa Mahabhuta. Raga, red color, is that of the Tejo Mahabhuta. Spandanam, Vayu Mahabhuta. Laghuta is that of the Akasha Mahabhuta. So these are the qualities which could be seen. Rasat Raktam Tato Mamsam Mamsat Medak Prajayate Medaso Asti Tata Madhya Madhya Shukram Tyujayate. The rasa is the origin for the development of all the dhatus. Now, whether the dhatus would be produced by one after the other is another question, and all that question comes in because of certain confusion about the translation of the dhatu. When we translate the dhatu as a tissue, you will have a lot of confusion. It's not that the muscle tissue or the adipose tissue is formed from the blood, or rather the muscle is not formed by the adipose tissue. So that kind of a perception is not a real perception. The correct perception of dhatu would be about the function. We will have more discussion about the correct perception of a dhatu in the coming chapters when we discuss about the dosha dhatu mala in the coming chapters. Right? So for the present, you just consider that the perception of the dhatu as a tissue or translation dhatu as a tissue is not a perfect translation. Rather, there is, you need to consider in terms of the functions and the base of the functions. Now, and if you consider that way, the functional speciality, gaining that specific functional speciality would be primarily based upon the basic metabolic function and energy producing function of the body. And whenever there is a need to conserve, suppose there is a disease process and the body has to conserve the energy, that energy conservation starts in the reverse order. Like if there is some abnormality of the basic functions of the body, but otherwise all the other tissues are maintained, the nourishment of the other tissues can be maintained. It is the spermatogenesis or the reproductive function which is affected. If suppose the pathology is more severe and then the abnormality is more severe, it's about the abnormalities of the bone, and the bone this physiology would be affected. You'll have the osteoporosis, and the ligaments and bones, they become weaker. Mobility of the person is reduced. This is how a response of any human being to the disease. And if it is still more, then you will see that the muscles and the fat, these they become atrophied. And in the still more severe cases, the fat tissue becomes reduced. So when you say emaciation, if you study the process of emaciation or incarceration, the other word is incarceration, which could be produced due to multiple causes. But when it occurs, you will have a sequential process. The sequential process is a primary tissue or a primary function which is affected is the reproductive function. Then comes the other way, the bone and the bone functions as such. I don't say majja as a bone marrow or so on. Okay, we will come to that part later on. What is majja and what's asti, and we will come to that part in the coming chapters. But you will have a gradual degradation step by step. And this gradual degradation follows the reverse order of what Ayurveda says about the nourishment of the dhatus. See, we say rasa raktam tato mamsa. Mamsa is the adipose tissue, the tissue which is producing a covering over the body, layer part, and it's just below the twaka. And the medas, and medas is the substance functions which maintains the fluid and electrolyte balance in the body, as well as it also helps the the production of muscles, tendons, and so on, the kandara, etc., the structures which support the bone, and then of course the bone and so on in gross. We'll have more detailed discussion about these issues in the coming chapters. But the important is what you see in the degradation or incarceration is the reverse order of what you see in the of what Sushruta or Ayurveda says about the nourishment. So the fact, like there is a gradual step by step progression of the different functions of the body, levels, functional steps of the body, is absolutely true. Only the thing is, the confusion would occur only when you translate the dhatu as tissue and you keep them in a different compartments. The adipose tissue separately, muscle tissue separately, and the bone tissue separately, and study them separately. Then the confusion starts. There is nothing wrong in studying them separately. It's absolutely correct. But at the end, all these, whatever you studied in the different chapters, they need to be integrated, and that integrated look is necessary to understand Ayurveda. So when you read Smithas, that's the one of the important issue which you have to keep in mind. तत्र एतेषां धातूनाम् अन्नपानरसप्रीणयिता रसजं पुरुषं विद्यात् रसं रक्षेत् प्रयत्नतः अन्नात् पानानि च तत् अतिमतिमान् आचरत् च अपि अतन्द्रितः. So hence, because all the dhatus are based upon the annarasa, to maintain a healthy body, you need to focus on the annarasa. So that food and food habits, and ensuring that you have a proper quality of this nourishment from the source of the nourishment in the body, they can prevent many of the diseases. Almost you can live healthily. So value importance of the food and the nourishment, the physical activity, what we call in brief as lifestyle. It is based upon this concept, like every function of the body is dependent upon the primary source of nourishment, and if you take care of that nourishment, which is mainly about the food and the physical activities, you can preserve the health, and that's the major core strength of Ayurveda as such. Now then the question comes in, like now, because during that period itself also somebody might have question in the class, like if it is so, like the rasa results in the formation of the shukra, or there is a progression, and if it takes more time, then how the Vajikarana Aushadis can produce they are claimed to produce a shukra, and so that could be the question. The question as a Vajikarnas Aushadaya Sobala Gunotkarshat Vilechan Vadupekta Shukram Shigram Viletanti. Sushla has clarified, like Vajikarna Aushadis, they really may not really increase the production of the shukra, but they will facilitate the excretion of the shukra, which is already collected in the body, which is already present in the body because of their qualities. Swabala Gunautkashat, Virechanavat, as you produce the purgation, similarly, the fecal material which is stored in the intestine is forced out. Similarly, the shukra which is present in the body is forced out by Vajikarana. So, Vajikarana Aushadis may not really increase the quantity of the shukra production, but they will facilitate the shukra excretion. If you go on administering Bhajikarna Aushadhi infinitely, it may give a reducing results. The results may not be the same as such. That's the important issue. Now, some more of these theories, because of this confusion, Shrishta had to give some more clarification. And those clarifications are यथा हि पुष्पमुकुलस्थो गन्धः न शक्यम् इह अस्ति इति वक्तुं नैव नास्ति इति अथ च अस्ति सतां भावानाम् अभिव्यक्तिः इति ज्ञात्वा केवलं सौक्ष्म्यात् नाभिव्यज्यते स एव विवृतपत्रकेशरे पुष्पे कालान्तरेण अभिव्यक्तिं गच्छति एवं बालानामपि वयपरिणामात् शुक्रप्रादुर्भावो भवति रोमराज्यादयश्च विशेषाः नारीणां. So then there was another question probably in the classroom, like how you consider this shukra, is it only semen? Now, Shushruta, Dhanvantari, the teacher of Shushruta, would started giving some explanation. Shukra is not only semen; it's a primarily reproductive function which is present in every cell. See, reproduction is one of the basic quality of life. The reproduction starts in each cell. Each cell has a capacity to undergo mitosis or meiosis, that division occurs, which may not require when you say mitosis, you need to have the two components of two cells, and then it has to produce this. Meiosis, where the same cell divides and then if the components, the nucleic acids, they replicate and then it produces the further generation. Anyway, that's mitosis and meiosis are the two methods of tissue replication. Now, this also is a shukra. There is a component of shukra in that level also. That reproductive quality is seen in every cell, but it may not be seen as a separate substance. But ultimately, when it comes to the question of this replication of the total body, then all these capacities are focused or merged together to produce a tissue which could be identified as semen, or in females, again, it may not be identified as the rajas or the blood flow, but the ovary. Now, when there is a ovum and the sperm merges together, then there will be a meiotic. First division is a meiosis, and then you will have the mitosis. Further divisions occur, and that's how the life starts. Now, this kind of a function is not visible directly, unlike that of the visible semen and the ova. And that's why Sushruta gives an example, simile of Pushpamukulasto Gandha, like the smell which is present in the flower, which is not visible and which is present only during a certain phase of the life of the flower. See, before the flower blooms, you do not feel the smell. Only at certain stage, as the flower blooms, the smell is felt. And then again, when the flower dries up, the smell is not felt as such. So you cannot just say that the smell is in the flower or smell is not in the flower. Argument could be anyway by looking at the stage in which you have seen the flower. Similarly, these reproductive functions being focused, which are capable of producing the uh, which are produced in the later part of the life, they are present in the birth itself in the earlier age of life too. So hence balanamapi, in children it may not be seen, but only after a certain age of life you will be seeing those features. As in flower, again example, vivrta patrakeshare pushpe kalantarena abhivyaktim gacchati. In the later on, when all the other supporting structures of the flower, like the stems and then the petals, they bloom, then only the smell is felt. Similarly, in the human being too, when the secondary sexual characters develop at the time, the sexual functions or reproductive functions are seen. That doesn't mean that reproductive functions do not exist earlier. स एव अन्नरसवृद्धानां परिपक्वशरीरात् शरीरत्वात् अप्रीणनो भवति तयेते शरीरधारणात् धातवः इत्युच्यते. Now, in older age, the same annarasa would have a lesser capacity to produce the same dhatus or these functions, and the semen also, this reproductive function also is reduced. And in total, because of these functions of maintenance of the life, they are considered as dhatus. Dhatus are mainly functional, not really structural. That's all what we can limit to in the present level. When we go into the coming chapters, we'll have more discussion about what is rasa, mamsa, and how we look at it from the contemporary science point of view as such. तेषां क्षयवृद्धिः शोणितनिमित्ते तस्मात् अधिकृत्य वक्ष्यामः तत्र फेनिलम् अरुणं कृष्णं परुषं तनु शीघ्रम् अस्कन्ति च वातेन दृष्टं नीलं पीतं हरितं श्यामं मिश्रम् अनिष्टं पिपीलिका मक्षिकाणाम् अस्कन्ति च पित्तेन दृष्टं गैरिकोदकप्रतीकाशं स्निग्धं शीतलं बहलं पिच्चिलं चिरस्रावि मांसपेशी प्रभुं श्लेष्मदृष्टं सर्वलक्षणसंयुक्तं काण्डिकाभं विशेषतः दुर्गन्धि च सन्निपातदृष्टं द्विदोषलिङ्गं संसृष्टम्. Now, because the major functions of all the dhatus are depending upon the shonita. When I say shonita, it's a combination of rasa, blood, rasa and the rakta together. Because all the functions of the dhatus are depending upon the shonita, importance is maximum importance is given to the healthy status of the blood, and the blood itself would be means by which the abnormality of the body can be made out. So majority of the biochemical tests which you do, they are depending upon the examination of the blood, either different components, and this can be made out by assessing the physical or chemical property of the blood. So when you go to the laboratory, almost 90% of the diseases require some investigation which is related to the blood to confirm the diagnosis. Is it not true? Now that's exactly the reason why the blood is given maximum importance. The shonita is given maximum importance. And what you make out would be to assess either certain physical property or the chemical property of the blood, and that chemical property is assessed by an array of biochemical tests, and that's how it is done. Whereas the methods described by Sushruta in the Ayurvedic text would be very looks crude, like examining the physical property only, like when there is phenylum, when it produces more foam and the color is red or blackish, and the specific gravity is reduced, and the flow is this clotting is slower, that's considered as water drushti. When the color has neela pita harita, reddish, bluish or yellowish color, and the smell is altered, and it's not taken or not accepted by the insects. Insects reject that blood. That's considered as a pitta drushta. Whereas when there is an increased clotting capacity, specific gravity is more, and the color is color is of a gairika, the thinner as such, and the specific gravity is more. That's considered as the sign of kapha. It's difficult. It's not sufficient to translate that in that manner, or it's not proper to translate exactly to that level. All that biochemical parameters which we now consider, they can be categorized into these categories, and they help in making the diagnosis. A healthy blood would have indragopa pratikasham asamhata avivarnam cha prakritistam janiyat. A healthy blood would have the color of indragopa, a bright red color, and it has the specific standardized clotting time and a healthy acid. We'll stop at this level today, and we'll continue in the next session about further. If there are any questions, I'll try to answer, and then we'll conclude today because time is up. There is one question. Can you please explain once again how the reproductive system is affected first to the disease condition? Okay, all right. This part we will have more discussion when we go into the coming chapters of Doshadhatu Malavijnana. There we will come to that part later on. It's very simple. Whenever a function incarcerated patient, See, irrespective of the system of the disease involved, and if we say that the patient's function is affected, the physiology is affected, the first of the thing is the person will be losing interest in the sexual activity, sexual life. This is what you observe in the clinically, and you know, another very common disease in the females now is the menstrual irregularities, PCOD. PCOD, the major exact reasons are not known, but that is the first sign of having a improper health. That's exactly the point. So whenever there is a abnormality in the physiological functions of the body, the first of the sign which is seen, first of the symptoms seen is about those sexual activity of the person. Of course, we now in the contemporary situation, you will see lots of things before the emaciation occurs. Now, gradually, as the condition becomes more severe, you will have the changes in the bone tissue, muscle tissue. See, or rather, when you have felt ill anytime, the first of the thing is you will be losing interest in the surroundings. You will start having the pain in the joints or feeling debility or inability to move. Then, if it goes further, then you will have the weight loss, the muscle atrophy, and the fat becomes degenerated. So, you will have that kind of sequence, and maybe in the due course of time, the hemoglobin also is altered. That's the usual course of a emaciation. Or if you go for fasting, now instead of going for the disease, now with the diseases, you may have systematic changes. You try to do that, or if you observe the patients are fasting, on long time or malnourishment, this is the sequence which you see, and that's what we say as incarceration, and that is seen clinically, but we do not have a proper explanation like why the things go on in that manner. So Ayurvedic perception of Rasat Raktam and then finally leading to the Shukra, that kind of a concept might have perceived by this kind of a practical clinical observation. That's all the point. Hmm? Right, okay. And more of these we will have in the coming sessions as such. With this, we'll conclude today. Thank you.